Hi, everyone. My name is Jillian Parker, and thanks for joining us for today's Facebook Live discussion. We are going to be talking about the effects of COVID-19 on patients with dementia, Alzheimer's, as well as their caregivers. And joining me to talk a little bit about it is Dr. Marla Bruns. She is a cognitive neurologist and co-director of Rochester Regional Health's Memory Center. Dr. Bruns, thanks for joining me today.
Thank you for including me in this. This is Alzheimer's Awareness Month, so thank you.
Yeah, it is Alzheimer's Awareness Month, as you mentioned. And, we've been talking about the impact that COVID has had on so many people's lives. A lot of routines have been disrupted, but for those with dementia, the effects can be devastating. So can you tell me over the last couple of months what it is that you've seen in some of your patients as a result of COVID-19? Kind of let people know maybe what they should be on the lookout for as well.
Yes, in the Memory Center here, we focus on patients with any kind of memory loss, mild, all the way to severe dementia, and not just of dementia caused by Alzheimer's disease. There are several diseases leading to dementia, but everyone's lives have been disrupted routine-wise by closures and just having the access to groceries and medications and activities like we usually do. And while you and I are struggling with the anxiety or stress of trying to work from home sometimes, or just separating ourselves, trying to manage all that and not even remember why you're doing it is even more of a struggle. Just not being able to remember why you're doing things on a regular good day is struggle enough. And then you put in this unprecedented wrinkle of coronavirus, and I've seen a lot of setbacks.
You mentioned those setbacks. Those setbacks affect the caregivers, the families who help to take care of these people. Do you have any advice for them to try and make sense of some of the changes that maybe they're not used to seeing, or the setbacks? And is there anything that can be more helpful if the person in their life is going through that?
Right. I think the biggest setback has been the social isolation. And while a lot of caregivers are in the right place, thinking they don't want to expose their loved one with dementia to the virus potentially, so they may not be visiting as much if the person's in their own home, but they also may not be able to visit if the person's in a assisted living facility or a memory care unit or nursing home. So it becomes even more isolating, and the individuals may be more withdrawn if they can't see their family members or friends. So if you can't physically be with the person, trying to call them more often, reaching out, and just trying to lighten that burden for them, which they may not understand.
Mm-hmm.
They may figure everyone has left them because they don't like them, not because they're trying to keep them safe. And you could explain, 13 times, in 5 minutes that, I can't come over because I don't want to get you sick. And they just won't remember that 5 minutes later. So just being there emotionally is the biggest thing, and trying to be mindful and observant if you see changes in the loved one's personality, and trying to be proactive. So a lot of people in facilities aren't able to even eat in their communal dining areas, so they're even eating alone. So trying to find out of the box ways, sometimes tablets, any form of video chatting like this may be possible, but oftentimes you need to rely on the staff at the facility to help the person connect. So It's been challenging for me.
Hi, everyone. If you were tuning into our first stream, we had some technical difficulties, but we are going to continue our conversation with Dr. Marla Bruns. And for anyone who is just tuning in, we're talking about some of the effects COVID-19 has had on those with Alzheimer's, going through dementia, as well as kind of how it affects the caregivers as well. And when we got cut off, Dr. Bruns, you were talking about how important it is for especially if you're someone who's been isolated and you are going through dementia, how important FaceTime calls are, any type, maybe even, I know we didn't mention it, but how important are the FaceTime calls, and maybe even stopping by to interact through a window space if you can, just to wave, or I know we've seen a lot of signs arriving at some of the nursing homes and other facilities.
Yes, thank you for your patience with getting back up online, but the challenges that we're having today is just one of the examples of challenges I have reaching out to my patients and their caregivers. But even at the facilities, connecting electronically, there may not be enough equipment to do so. So definitely the in-person visits, showing up at a window, making sure the patient's ready to see you and not ready to jump out the window and run away with you can be a problem too. So anything that's creative and outside the box, just so that they know you're there no matter what. Phone calls, even without the video chat, is helpful as well. Some people are on the inside room, so you can't stand at their window. But I think if there are visits outside that are possible more and more frequently, hopefully that will be possible. There are a lot of individuals, though, with mild cognitive impairment that don't meet the criteria for dementia prior to the pandemic, who are now experiencing setbacks because they're not able to keep up their routines of staying active physically, mentally, and socially. And if you test them now in the office, they may meet criteria for dementia. And I'm hoping that this is a temporary setback, and as routines can have some semblance of normal, they will remain independent and have that mild impairment. But really, even the individuals that live in their own homes or live with other family members are feeling the strain from this pandemic. And so as much support that can be lent from family and friends is so important. And go ahead.
Oh, I was going to say, what should any caregivers, family members be on the lookout for in regards to maybe they're just starting to suspect that a loved one may be showing some signs of dementia, especially over the last couple of months?
So a lot of times my patients will be helped by this analogy. I talk about the concept of cognitive reserve quite often. And how I understand it is if everyone is born with a bucket of water as their brain reserve, your whole life you're putting water in that bucket. You are learning how to walk, ride a bike. You may in school learn multiple languages. Mm-hmm. Everything you're learning, the farther you go in school, the more interests you have, the more sports you play. More hobbies, and that's why all the research and activity in preventing and slowing down dementia has been so important. But as we're always putting water in this bucket, there is a slow leak for aging, and we can't plug up that hole. And sometimes there's a slow leak in the bucket from Alzheimer's disease or a different disease causing dementia. And it has been slowly draining the water from that reserve, but no one has noticed because of all the education, hobbies, and how busy a person keeps themselves with activity. But now with the COVID-19 stress on everybody, that's really splashed a lot of water out of the bucket. So if your water level was draining before and no one noticed, this pandemic may be just the thing that really clinches the fact that there's a problem. And so if you're now more aware of it and your loved one isn't able to hide those problems as well as they were before with all the social graces, it would be best to call the family doctor. The primary care physicians are really on the front lines and in the trenches. We really depend on them to do a lot of the screening, testing, checking labs for bladder infections or thyroid disease or some reversible causes of memory loss. But if all those things are normal, making sure that they are referred to doctors like those at memory centers to narrow down a possible diagnosis of a degenerative disease such as Alzheimer's. I don't know if I'm still connected, so I'll still give you some tips and things that I've noticed during this last few months. A lot of my patients have been stellar superstars at staying active, going to senior centers, going to the YMCA Silver Sneakers programs, and they are really struggling with all those centers being closed. So there are some YouTube videos with activities you can do at home. Just searching the Alzheimer's Association website, and there are all sorts of activities, just like you might be looking up to help keep your kids at home be entertained. There are all sorts of resources to find to keep your loved one with dementia or cognitive impairment busy, because just hiding out and watching TV is a guaranteed way to accelerate cognitive decline.
Can you hear and see me now?
I can hear and see you.
Yeah. Sorry, I don't know, more technical difficulties, but
I thought I had to go. That's
what happens. Thank you for continuing on and just continuing to talk about the effects on those with dementia and Alzheimer's. If, as we were talking about, the signs worsening over this time of COVID with isolation and other things, if help isn't sought after, could it worsen? And what is the best method for someone to get involved by contacting you if they have been picking up those signs during the course of the pandemic?
So I think sometimes patients will, or they're not my patients yet, but sometimes individuals with dementia will resist any help. They will be quite agitated and react as if you're nagging them, or they'll be in quite a bit of denial commonly. So sometimes it's very hard to get them to be seen by a physician. So trying to help by establishing a routine, making sure that the home is a safe setting, and maybe labeling drawers, cupboards, if the person is complaining that they can't find things or they lose things or someone stole something from them and clearly no one has been in or out of the house. Putting up reminders, sometimes whiteboards and calendars, and clocks with big numbers, sometimes clocks that have the date on them and the month, and even so I just got a countdown again, so I hope we're live.
Here we are again.
Thanks, everybody.
Thanks for being patient with us, guys. I'm sorry, we must be having some connection issues. Do you want to pick off where you were? Or do you want to?
I was just summarizing some tips about writing notes, labeling things, keeping a calendar, keeping clocks in every room, trying to help with medication sorting devices. Some are simple, some can have alarms on them, some can be linked to an app on your phone so you can see if mom or dad has taken the pills out that day. And if they haven't, you'll get a text on your phone. There's all sorts of technology to keep people independent and safe. even if they won't make a trip to be officially diagnosed. But the resources at the Memory Center for Rochester Regional Health, and we work closely with Lifespan of Rochester and also with the Alzheimer's Association, trying to get resources and respite programs for families that are struggling, not just during this time, but they've always been available with programs, but now more than ever. So I think, go ahead.
Oh, go ahead. There's been a lot of conversation about people who are high risk, people who are low risk. Are patients with dementia at any greater risk of getting COVID? Or if they did get it, would it be any worse?
So yes, people above a certain age, over 60, are considered at risk for the virus, but most cases of dementia are higher risk over the age of 60 as well. And if you're over 65, the latest numbers are that 1 in 9 people over age 65 have Alzheimer's disease in the brain. And with aging, that risk of having dementia goes up. If you're over 85, the risk is up to 1 in 3 people with Alzheimer's disease. So just living longer is a higher risk factor. But oftentimes people will ask me in the office, well, I've never had a family history of Alzheimer's. Why is it happening to me? Well, there are some genes that are known to increase risk of dementia. And some of those genes have been looked at as far as is that an increased risk for contracting coronavirus. That was a small study done in England. But I think the results of that are kind of muddy, because if you're over 65, you have a higher chance of other comorbidities like diabetes, high blood pressure, all of those things which would make you higher risk for coronavirus. But the problem with dementia patients is that they may not remember to wash their hands long enough. They may not remember to wash their hands at all. Generally, patients with dementia do have problems with hygiene. Just like you might tell a little kid over and over, you've got to wash your hands. Patients with dementia may say, "Oh, I did." And then you go and, the towel's dry, the soap hasn't been used. They just don't remember that they didn't. So,
right.
And they don't understand or remember why everyone's wearing a mask. They feel fine. So, logic in the dementia reality just doesn't work. So they are more at risk for contracting the virus because of the hygiene issues, but it tends to, it stands to reason that they would more likely also get a more severe case of the virus as well.
You mentioned, hand hygiene, proper PPE. If someone is confused about wearing PPE, having to change, their routine due to the new guidelines, is there anything that you would recommend?
It's trying to keep your patience, and even if it's the umpteenth time that you've said, nope, you got to wear the mask up here, and trying to stay home rather than be out and about where you have to wear a mask, and just avoid the exposure to begin with is the biggest thing. But really just patience and trying to stay calm, because even if they don't remember why you're wearing a mask and why they should be wearing a mask, they will still understand or remember the tone of your voice when you're yelling. And even if they don't understand what you're saying or why you're yelling, they'll remember that you're yelling, and that's never a positive thing.
Now, you mentioned patience. I know patience is key. Are there any common mistakes that people make?
So the video, I'm sorry, Jillian, your video
To
froze.
avoid doing? Oh, Can you hear me?
You're moving again now, but I think you were asking, are there any common mistakes that
That
caregivers?
people make communication wise when they are just realizing that someone might be having some of these signs, anything that they should avoid doing?
Yes. Sometimes I advise family members to add this to their um, batch of swear words. So try not to say, come on, you remember, or don't you remember, or you know why you have to wear this mask. Those things are just simply not possible for the person to remember. And reminding them that they don't remember just becomes a negative cycle and can be very anxiety provoking and depressing, not just for your loved one, but as you keep seeing the decline, uh, will also make you sad. So just trying to remember yourself that they just can't remember. And it's not them, it's the disease in the brain that's making it impossible to learn new things and cherish the good moments when they do remember something, and keep taking one day at a time, sometimes 1 hour at a time.
And what do you recommend for people who are just noticing those signs? What should they do?
Try to keep a list or some kind of journal of the things you've been noticing, because a large proportion of people get to my office and I say, well, what kinds of things have you been noticing? And oftentimes people don't want to say what they've been noticing right in front of their loved one. So slipping me a note of what you've been noticing is a lot kinder, less critical or confrontational. But always asking, is this normal? But I always explain to my new patients that my job is to figure out how much forgetfulness is part of normal aging. Sometimes just having too much to worry about, having too much to remember, can keep you from taking in new information. You always want to make sure that your loved one can hear, because sometimes hearing loss is mistaken as a dementia. Even if you know that they can't hear and should be wearing hearing aids, they still may have an underlying dementia disease as well. But also just making sure that you're keeping track of things and bringing it to the attention of either your primary care doctor or someone like me in neurology.
And what is the best method to get in touch with you at this point? How much are you still seeing patients via telemedicine? Are you seeing people in person? How has that been for you at this time? How have things changed?
Uh, I think I'm back in the clinic essentially full time now. There are a few cases, circumstances dictate that I have to contact them through telehealth because they're at a facility. But those are just follow-up patients. New patients we're seeing in person. The memory center is seeing new patients, accepting new patients. So calling our clinic is, the number is 585-723-7972. And we can put that in the comments, I'm sure.
Yeah.
But also, we need you to have your family doctor send a referral too. So starting with your family doctor is always a good place as well.
Is there any is there anything else that you wanted to add that we have not touched on here?
I think just taking a look at the safety of the home, if the person's living by themselves, if you visit with your mask and you haven't been there for a while and you see the fridge is not stocked or is full of food that's gone bad, that may be a sign that they're not remembering to eat. Look for bruises if you can. Make sure they're not falling and forgetting to tell you. And then, any questions, there's all sorts of resources through Lifespan of Rochester, the Alzheimer's Association, Finger Lakes Region Chapter, and even Elder Source. but really just reach out and ask. And
I am just checking to see if we have any questions in the comment section on Facebook right now to answer. It doesn't look like there's any questions here right now, but if anyone has any questions, once we're not live anymore, please feel free to leave them in the comment section. We can get back to you on them a little bit later. And I know you mentioned that phone number. I'll just mention it again, 585-723-7972. Thank you, Dr. Bruns, and everyone who's been tuning in for your patience. I know we've had some technical difficulties, which still during this time of doing some of these interviews via technology can be a little tricky. So thank you for your patience, Dr. Bruns.
Oh, my pleasure. I just want to reach as many people as have questions as I can.
Thank you. And again, thank you everyone for tuning in. Please feel free to leave any other questions in our comment section. We'll get back to them later.